We all know that cardiovascular disease, diabetes and smoking-related illnesses are a huge health burden in New Zealand. Too many people suffer from long-term conditions and die prematurely because of them. Although some are more predisposed than others because of their ethnicity, age or family history, these illnesses are largely preventable. Hi, I'm Dr. John McMenamin. I'm a GP in Wanganui and I'm the National Champion for the Better Help for Smokers to Quit. The more we can do to work with our patients at risk to help identify early health problems, the more likely they are to be able to live longer. For the health targets, our goal is to offer 90% of our eligible patients heart and diabetes checks and 90% of our smokers brief advice and support to quit.
All general practices in New Zealand are required to collect information about the heart health and smoking status of their patients and to participate in health target reporting. Kia ora, I'm Dr. Bryn Jones. I'm a GP in Hawke's Bay and I'm also the health target champion for the more heart and diabetes checks. The information that we collect is used in a variety of ways, including planning and funding, addressing inequalities and identifying areas in which we can work more effectively. So that's the big picture. At a local level, doing more heart and diabetes checks and offering better help for smokers to quit is important for improving the health and well-being of our communities and encouraging people to manage their own health better. Come on in, Jim.
Okay, thank you.
Yeah.
Morning.
Yeah, come on through. This can feel like an obstacle to our day-to-day practice, but heart disease, diabetes and smoking are big problems that deserve our attention and effort. This really is an area that we can make a difference. The good news is that there are some great IT tools available to make cardiovascular disease risk assessments and smoking cessation support much easier. A lot of GPs and nurses are having great success with these tools, in particular the tools that remind them to ask eligible patients the right questions, that allow them to update patients' notes quickly and encourage them to work with high-risk patients to manage their own health better. Many also use audit tools to identify those who are due for cardiovascular risk assessments or who should be contacted about their smoking status and offered help to quit if necessary.
The Ministry of Health has developed a series of videos on heart and diabetes checks and better help for smokers to quit. They include tips for the use of IT tools and advice for practitioners on how to help people with heart and diabetes checks and better help for patients to quit smoking. The focus of these videos is to help you minimise the administrative burden while maximising the clinical gain for our patients.